Recording is on.
Welcome to the Global International Pedagogical Forum IPF 2020, which I'm representing now. My name is Lilith. Today, my guest is Professor Irja Lutsar, microbiologist and virologist, professor of medical microbiology and virology at the University of Tartu. Honorable Professor, would you appreciate that you took your time to participate to the International Pedagogical Forum and answer our questions?
Thank you very much for organizing this forum in this very precious time of the coronavirus pandemic in which the world is suffering. And I'm also very thankful all the audience, all people who took their time listening to me.
Thank you. Honorable Professor, though the coronavirus infection has hit countries all over the world, there are still a lot of rumors about it. And the very first question is, does COVID-19 really exist?
Yes, I strongly believe that it does. I think that there are always rumors and there are always all sorts of stories, but I think that it's very well proven that the virus has been grown, the virus has been genotyped, the virus has caused the disease. The disease is similar in all countries, and you're absolutely right that almost all countries of the world have been affected. So I don't have any doubt that the virus exists.
So this is virus, this is not an ordinary flu, or is this something more serious? Because many scientists talk about the synthetic nature of the virus and that it was developed in the laboratory. What do you think about that?
Yes, I have heard those stories and I have read those articles, and being I haven't generated the viruses, so it's not my field of expertise, but as much as I know and as much as I understand those papers, and I also have spoken to the basic virologists in our university, they all say that it is actually a natural virus rather than man-made virus. So how it's spilled over to the human population, it's probably yes. We actually already many years ago we knew that coronaviruses would spill over from animals to humans. So that's not surprise. The question was when rather than if. It's very hard to believe that it is man-made virus, because there are many characteristics of this virus that this is actually naturally mutating virus, and we know very well that RNA viruses are very rapidly mutating, and new viruses, it's very likely that new viruses would develop. No, it's not the flu. This has several differences of the flu. So if we look at the influenza or flu viruses, or if we look at the clinical cause of the flu virus, then you know that the patient is the incubation period is a couple of days. The many people get sick at the same time, and it's a very severe or serious disease on day 1 and day 2 and day 3. But by the end of the first week of flu, most people already get much better. Here it is quite another way around. The incubation period is very long. So the incubation period, yes, the median time is about 5-6 days, but we have seen people who have been actually in contact with patients for more than 10 days or for 2 weeks. Mm-hmm. So the very long incubation period. The other thing which is characteristic here as well, and I think that everybody nowadays knows the disease history of Boris Johnson. So the first you get infected or you get the positive test, you are doing quite well, as Boris Johnson did. I mean, he was sort of running a large country in Europe and didn't have any significant health problems. but then the situation gets worse and worse. So first you get cough and you get fever, but you still are sort of okay to be treated at home. But then the situation gets even worse. So you can't be treated at home anymore because you are too sick. So you will be hospitalized. And you will be usually hospitalized to regular ward. And then you spend a couple of days in the regular ward and you don't get better. And then you will be transferred to intensive care. And even in the intensive care, it goes on. And then the last step is that you will be artificially ventilated. So and we see that in many patients. So the first patients are not that sick, but the disease is just progressing and progressing and progressing, quite opposite to influenza or flu. And third thing that I want to stress is also that influenza or flu, this is the disease of children. So if we think of the pandemic influenza, that was in 2009, 2010, and this was pandemic virus, then who got sick mostly? They were children, young adults, and who did not get sick? They were elderly people, because they already had antibodies against flu, and there might be other reasons. Here, what we see, the children are very little affected. I'm not saying that children won't get sick. Yes, there are many kids who have had coronavirus, and that's true. But worldwide, the mostly children either have very mild disease. Some of them are in ICU, and now this new syndrome that has been described in children that also occurs, but this is extremely rare. So this is not flu. This is coronavirus disease.
Okay, I'm very sorry, Professor, but I need to do a little technical remark. Could you please look at the camera, because we all the time see only side of your face. It will be better if.
Okay, I was mostly looking at you, but.
Okay, I understand. That's why I didn't want to interrupt
Thank you.
Okay, thank you so much. Let's continue. So the COVID-19, the pandemic, is widely spreading, and how to deal with it, what to do with the pandemic?
That's a very, very good question. I mean, I'm sort of heading the advisory board of the Estonian government, and just today we had a conversation with Prime Minister, and I said to him that, if there would be anybody in the world who would know exactly what we should do, we would do it. But this virus is new to everyone, and as if you have looked at around the world, that one country puts the complete lockdown since day one, the others have waited a little bit. There are countries who have more relaxed approach, and we really don't know what works. So what we have done is, in Estonia, yes, we have had lockdown, and this was relatively early lockdown. We had our first case end of February, but then more cases appeared at the beginning of March. And since 13th of March, we had the lockdown. This actually ended last Saturday or last Sunday. But our lockdown was not the most strictest one in the world. So we still had our kindergartens were open. We had some restaurants were open initially. Some shops were open, or food shops were open. People could go to work, although most people were working from home, and public transport was running, although it very infrequently. So it looks now that this social distancing works. So we have seen in Estonia, in other countries, that it's actually the infection rate is actually dropping almost in all countries except probably Russia and those countries in which the epidemic just started. So the social lockdown works not only for coronavirus. I mean, we have also seen very little flu. We have seen very little norovirus, rotavirus. So the social distancing works against viruses, but is it sustainable? Can the human population be locked down for years, or can the schools be closed forever, or can the universities be closed for many years? I'm seriously doubting in that. So I think that we need to probably it's better to keep this, to learn how to survive together with this virus, because I don't see vaccine coming into the market in coming months. So we need to learn to survive with this virus. So we deal with it if there is a problem, but we don't close entire country or entire society. Maybe it doesn't work in all countries, but it may work in a small country like Estonia. We think that our health department is currently sort of able to locate these places of disease, they control the epidemic, and we can still have society somehow functioning. But it is not easy to come out from the lockdown.
Mm-hmm. So at this moment so far, how many people actually get sick? What is the scale of the pandemic now in the world?
This is another difficult question. We know the number of registered cases. So there is more than 5 million people, according to data of Worldometer or Johns Hopkins University. That's more than 5 million people have been affected. But those are those people who have been registered. But we know that the registration differs from country to country. So there are some countries who don't do too many tests. Of course, they get less registered cases. So if I compare like Estonia and Sweden, in Estonia, we hardly have more than 1% of positive cases daily. So we do a lot of testing. So we do a lot of tests. We do observational studies, and I think that the sort of our data are close to be correct. Although we are currently running serological studies, so we are not quite sure. But if you look at the countries like Sweden, where 12 to 13% of tested people are positive. That means, or some Italian places also had like more than 10% places positive samples. That means that they should have this mild and maybe asymptomatic cases have not been registered. So it's very, very difficult sort of worldwide. For me, I'm certainly not in position to say how many more cases we have had, especially those mild and asymptomatic cases. So in Estonia, we think that maybe the number is 10 times more than currently registered, but I don't know that exactly either. But I have to say that if something has been sort of hidden or not registered, those are most likely to be mild and asymptomatic cases. I believe that at least in the Western world, the more severe cases that need hospitalization or unfortunately dying, those have been registered. So I think that there's probably in a year time, I would be smarter in that sense.
And what can you tell about the high indicator of infected doctors and nurses? What's the reason of that?
Yeah, there are probably also many reasons, and we are currently just today we were discussing how to analyze those data better in Estonia. And what we have seen that it varies from hospital to hospital. So in some hospitals, very few healthcare workers have been infected, and the others more healthcare workers have been infected. So that's our impression, and that's my strong belief that those hospitals that have very strict hospital hygiene or hospital infection control services, they are doing better than those who don't have that strict. So, for example, in our university hospital, I haven't been in COVID department. I even can't go there because I'm no help there. So I don't have anything to do. I can't go there. The elevator doesn't stop on that floor. The doors are locked, and only certain people can go there. And those people have been well trained. They have all the protective gear and masks and glasses and gloves and aprons and whatever you and however you name them. So this is certainly one reason, the very strict rule of hospital infection control. The other thing that we have tried, but probably weren't that successful, and the problem is, of course, these homes or institutions for elderly people, that really those people who have been sick or who have been in contact with the people who have had coronavirus, they don't come to work. So that has happened in our country, and I believe in other countries as well, because medical workers could be infected in the community as well. It's not necessarily that they get infected in the hospital. So we have concluded in our university that we should do much better training for medical students how to protect yourself. So it's not that it is anybody's fault, but we certainly need to learn. That's one lesson of learn in Estonia that we take forward, is that we need to have much better training and education on self-protection, especially for medical workers.
Yeah. Okay. Thank you. Talking about the China. So China turned out to be faster and more efficient in the fight against the virus. Wuhan is open now, and many European countries and other countries in the world are in very difficult situations. So what's the reason of that? It can be explained by the fact that China uses a monitoring system based on an example of SARS. And are there any such monitoring systems in other countries as well, who led the countries to take immediate steps to combat the virus?
Yes, it's a sort of difficult to, and I'm certainly not in position to analyze what China did right and what China did wrong, because it also depends on the customs. It depends on the political situation in the country, or sort of what people are used to and what people are not used to. The China was very effective in locating this disease only in this Hubei province. China is a vast country, but the disease really was circulating only in a relatively small area, which is 70 million or 70 or 80 million of population. It's a large in sense of Europe, but in the region in China is still relatively small, and they really kept the infection. They located the infection there, so in that sense they were very good. Now they also, there has been my understanding that they introduced this compulsory hospitalization to all patients and to all contacts. People were isolated either in hotels or in sport arenas, or maybe they had special buildings. Don't know exactly, but that has been my understanding. This may work in Asian cultures, and they were also monitoring people quite actively. So this may work in Asian cultures, may not be that successful in Western world. So what we did in Estonia, we decided right away that we are not going to hospitalize people who are not that sick that they can't be treated at home, and we are not going to block our hospital beds for isolating purposes, unless this is absolutely necessary. So I'm not saying nothing is 100%, but we have hospitalized from elderly homes sometimes if this was absolutely necessary. So, and I think that was also our success. We were trying to convince people that, in case you are mildly sick or you were in contact with someone who is coronavirus positive, you should absolutely stay at home. And if it's possibility, then you should be in separate room, or there were people who actually were renting a separate small apartment to stay in isolation. So yes, what worked in China may not necessarily work in Western world. The other thing which I think sort of retrospectively, what China did rightly so, that they almost on day one, they built those 2 hospitals. And I think that if we would be in the same situation next time, and if we sort of try to avoid complete lockdown of the society, then maybe that's the way to go, that you need to enlarge, or you need to increase your number of hospital beds, that everybody who needs to be admitted can be admitted, and everybody who needs to be ventilated can be ventilated as well. There is a third part in this question is, of course, how do you get enough qualified staff, and we have discussed that in Estonia many times, that I said that I'm a medical doctor by training, and I've worked in the hospital as a pediatrician for 20 years. So they could put me to work probably in emergency department or in pediatric department, but I'm certainly not able to do any work in ICU. And so those are the questions we have in Europe. In China, they were probably easier to resolve because they brought medical staff in from other parts of the China, because China is again very large country.
Yeah. So we know that virologists from Wuhan University warned of a coronavirus infection and released into the world a fully defined pathogen genome, so that everyone could as quickly as possible develop kits for researching the issue around the world. Has anyone dealt with it?
Yeah, no, I mean, I'm sort of not basic researcher, but as far as I know, that if this genome wouldn't be released, nobody could do any vaccines. So you know that people are currently working with several vaccines, and as far as I know, there are more than 100 vaccines in early development, and five to six are already in clinical trials and are producing results already, and also all the testing equipment or PCR tests are quite widely available right now, and the serological tests are emerging as well. So and there are many people actually looking at the evolution of these viruses. So in my group also, some people are looking at the genotypes of the viruses, and they are doing whole genome sequencing, looking at how the virus is evolving. So there is a lot of research going on in arena, and in that arena. And I think that if you look at the SARS-1, then the disease started somewhere in September, October, but the genome was sequenced, or whole genome. We knew what virus it is. It only happened in April, May next year. So this time everything was very fast. So that's certainly, and many people are working with it.
Yeah. You mentioned a few facts about COVID-19 that we already know. That the incubation period of the virus is 5 to 10 days, that we know the risk groups, men and women over age of 60. We know that asymptomatic carriers can infect other people. What else can be added to this list?
Yes, there are many things that we know, and we know this atypical Kawasaki-like syndrome in children, and we probably know also something on how something on the different treatments. Thus far, The results are very controversial. If you look at the antivirals, remdesivir, there was a Chinese trial in ICU. It didn't work. Then there was a NIH trial where they used the drug in not that sick people, or they started treatment earlier, and it sort of is working, but many other trials are ongoing. We know we have more data on chloroquine. We have more data on other antivirals, but really we also know that none of the treatments currently that we have is not 100% working. So the one thing which is very pressing, and where we do not have data, we know that the PCR positivity is very long. So the patient I know has had longest time is 50 days after being first time positive for coronavirus, and he's still positive. He's completely healthy. He has done all homework, and but we don't know exactly whether he's still infectious, whether he can go back to work, or he needs to sit at home. So we are currently speculating, having a very little data. We have seen this German data, and we have seen this American study that showed that you can cultivate the virus, or you can grow the virus, is the right way to say. You can grow the virus up to day 9, and after that, despite that PCR is positive, the virus is not growing. So we speculate that the virus is probably not alive, and there are data from other RNA viruses that show the same picture, like Ebola virus or Zika virus. The long PCR positivity is characteristic to those viruses as well, or measles virus, which is another RNA virus. And there is an explanation that virus is sort of losing the viral envelope, and that the virus cannot be alive, but RNA is still there. So that would be one thing I would, and everybody probably in this world needs to know, whether those people who have been PCR positive for a long period of time, whether they still are infectious or they are not. So that's probably something which probably doesn't quite answer to your question, but it's sort of somehow answers as well.
Yeah. So we do not have so far effective treatment, new fundamentally effective treatment for that. Yeah. And we do not have a vaccine as far. When it can appear, when we can expect it to cure us?
That's a good question. The honest answer is I don't know. But if we look at the coronavirus, at least to me, it's a virus and that causes acute illness. And if we look at the other acute viral infections, so you don't have antivirals that give you sort of wow effect. So if we take the chronic viral infection, and especially probably the best example is hepatitis C. So for a long time, no treatment or sort of very average treatment for hepatitis C. And all of a sudden the DAAs came into the market and the picture is completely changed. So the response rate is close to 98, 99%. So nothing like this has happened with the antivirals that are meant to against acute disease. Influenza treatment, it's okay, but still efficacy around 50-60%. The same for herpes virus, although herpes virus is latent virus as well. So that brings me that I'm not terribly optimistic on these antivirals. Where I'm looking for these antivirals is whether there are going to be antivirals that can be used prophylactically. And vaccine, to me, the vaccine would be more promising. So this week, the first data came out from Moderna vaccine. There were first 5 to 8 patients, and they responded with antibodies. And this gives me, under the phase 1 trials, it looks like didn't show a significant safety concern. So it looks like Moderna is moving forward to the phase 2/3. So it's more hopeful, and there are some other candidates, but I honestly don't see, unless these new vaccines are terribly effective and very, very safe, that you can somehow combine the phase 3 trials with the not marketing, but with the market or wider use in the market as the development was done for Ebola virus. And I would think this would go in this way, but I honestly don't see that anything will be marketed or available for all countries before next summer, and this is only in the case when we are very, very lucky. Everything goes by the book, but those people who have been in drug development and have worked in drug development know that 2 steps forward, 1 step backwards, 2 steps forwards, 2 steps backwards. So it's not a sort of a linear process.
Mm-hmm. And what about the immunity? Does immunity develop after the virus, and if so, how long it can protect us? And is it true that people who have had the virus cannot get sick again?
Yes, I'll start from your last question. Yeah, it looks like that people who have got the disease don't get sick again. So those cases that have been reported, that people like having a disease second time or third time, this is most likely the very long PCR positivity that I explained to you earlier, and this is very, very well known. Its current thinking is that the people get sick with coronavirus at least during this one season, just once. So whether antibodies would develop, yes, there are many studies right now that have shown that people are developing antibodies after having been very sick or moderately sick. So antibodies would develop. And now the data are coming out also that not only sort of general antibodies, but also neutralizing antibodies that sort of can neutralize or that can protect you to be infected again, that those antibodies are developing as well. So now the question whether they would develop in everyone, it's sort of another question. There was a very recent paper published, I just saw that last week, where they were looking at the antibody development in severely ill people, in moderately or mildly moderately ill people, and also in asymptomatic carriers. And they took, in this study, they took several PCR samples or nasopharyngeal swabs and PCR them several times. And then they also took blood to measure antibodies. And if you look at the sick people, or those who had were very sick, or those who had mild to moderate disease, they almost all of them developed antibodies. But when they looked separately, the group of asymptomatic people who had PCR positivity and repeatedly PCR positivity, 5 out of 6 of those people did not develop antibodies. So what does it mean? This asymptomatic disease, is the viral load very small, and what does it mean in terms of antibody development? We really don't know right now.
Okay. And there are a lot of rumors about the summer temperatures, that pandemic will decrease with summer temperatures. Is that true?
I don't think that the temperature is the factor, because if you look at the first affected countries in Europe are Italy and Spain. And of course, nobody has been right now there. But if I'm looking at the TV, people are in T-shirts. It looks that it's a nice weather there, and sky is blue, and sun is shining, quite opposite to Estonia, and the disease is still there. But there is something with the coronaviruses and summer. So the coronaviruses, like flu viruses, they tend to disappear for the summer months. It's maybe not only temperature, but it's probably also the air pressure and the humidity and all those factors, and maybe also in our part of the world of the length of the day, and these all play a role. So this is actually quite well known that coronaviruses are not summer viruses, quite opposite to enteroviruses or some others, and some viruses don't have this seasonality. That in general coronaviruses would disappear for summer months and come back in fall. With this virus, I honestly don't know. It looks like that the disease frequency is dropping in almost in all European countries, and in many European countries, especially in Eastern Europe, the number of newly infected people is very small already. But whether it's because of the summer or whether it's because of the certain length of the epidemic, I don't know.
So, what measures should be taken not to suffer from coronavirus? And we know that self-isolation, we know that some states impose quarantine, lockdowns. So are there necessary and are there effective measures?
Yeah, the social distancing is certainly effective in preventing infectious diseases. And this is not big surprise. I've known that for many years, and if you take the pediatric population, if you keep kids at home and they are sort of living in small villages, they are sort of healthier in terms of respiratory viruses than those kids who go to the kindergartens and live in big cities. And if you even look at the if you look at this coronavirus disease, what it is a disease of parties and companies. So if you look at how it started from big crowds, not from the ski slopes, but it started after skis. In Estonia, we have seen several birthday parties, or sort of relatively large birthday parties, where several people got sick, or we had a volleyball game and people got sick. This was fully packed, and people were shouting and whistling. So and there was a lot of spread of coronavirus. So this is the disease of the crowds, and this is the disease of the big cities. Whatever country you look at, Wuhan itself was a very large city, 10 or 11 million of population. In other countries, Milan, Madrid, Paris, Tehran, New York, and the huge number of cases in those places, and much less cases in small villages or small towns. So the keeping people apart certainly would work. Is this sustainable for a long period of time? Can we all stay at home and sit at home and wait until this virus goes away? I don't think that this is the case. So the human beings, in addition to be worried and afraid of the virus, they are also social beings. So we need each other. We need this human-to-human contact. We need to see our families. We need to see our friends. We like to work. We like to come to work. So I think that we need to learn a couple of things, and people have already learned that you don't come to work when you are sick. It's better to be at home probably a week or a couple of days when you are less sick, and you come to work then again. So you don't go or you don't arrange a party if somebody is sick. So hand washing, well known, you should wash hands, and you keep social distancing. So there is sort of no need to, if this is a possibility, of course that's not always the possibility to keep people apart. But also what I want to say that in many countries now the wearing masks is compulsory. One could argue whether it's needed or not needed. Maybe it's not needed 100% of time, but in crowded places, in public transport, it's also a sort of part of social distancing. So it's a respiratory virus. It spreads via coughing and sneezing, but it also spreads via singing and talking. I think that a lot of viral spread is ongoing via talking. So those are the things. Nothing by itself is 100% effective, but if we combine all of those, that we can prevent, and that has been shown in many countries where the coronavirus is quite well controlled at the moment.
As you mentioned, most of European countries has passed the peak, and lockdowns are being relaxed. But as you already said about other diseases, is there a danger of second wave for coronavirus? And if it's so, is it correct to remove all restrictions now?
Yes, I think that the risk of the second wave is very high. So if you look at and we can call it herd immunity, or we can call it with other words, that doesn't matter. But if you look at the number of people who have had some contact with coronavirus across Europe, and even in countries that were heavily affected, like France or Spain, then the percent of there are currently serological studies coming out. 5% of Spanish people have antibodies, although yes, the percentage is much higher in Madrid, 11%. But in many other countries, like Scandinavian countries, 1 to 2% people have antibodies. So even Sweden, and Sweden has been talked a lot, and even in Sweden, where many people, it seems to us that many people got affected. Even in Stockholm, they say that probably 20% of those people living in Stockholm have antibodies. So there is a lot of immune naive population in the world. So the risk of the second wave is very, very high. Does it help to keep everything locked down? I don't think so, because this complete lockdown, and I'm very much for fighting for people's health, and I'm sort of physician. I'm of course worried of the health of the people, but the complete lockdown is hugely damaging our economy. Some sectors got hit worse than the others. But even if you take education, and we had home education in Estonia, kids and we are very much computerized country. Every household has a computer. That's not the problem. But I have heard the teachers saying, the math teachers saying that, some kids, they just need to be explained. They can't get it via internet, especially those who probably have working parents, and not every mother or father has degree in mathematics. So even those sort of small things, but it's affecting the whole life of the society. But we are currently thinking in Estonia that we have done quite a bit relaxation. So far so good, but I don't know what happens tomorrow or day after. Of course, we are monitoring very carefully, but if we need to close down something, then we will not lock down the entire country, but we try to monitor the cases and lock the places where it happens. Of course, if the epidemic is out of the control, you can't do that. But at least at the beginning of epidemic or at the end of epidemic, we saw here at the university very well. We had an outbreak in one dormitory. We only closed the certain floors in this dormitory, and everybody else was open to move. And we eliminated this outbreak. And so we have done in this elderly home. So our policy is more targeted rather than to, if we have a problem in our capital, Tallinn, we don't need to close the schools in Estonian islands or in South Estonia, which are very far from the capital. So I don't think that we can keep whole world closed for, I don't know for how long when vaccine comes, but I don't know whether the vaccine comes next summer. Maybe it does, maybe it doesn't. So we need to, so my message is that let's learn with this virus, and let's think that the virus itself is not actually, or himself or herself, whatever you want to call it, it's not interested in killing us, because his multiplication depends on us. So that's not in his interest to kill us. We are overreacting. So to viral infection, and that's when all problems start.
And what is the current situation now in Estonia?
We say that the current situation is under control. We have had less than, we have in last 14 days, I think that the number of new cases has been around 50, 60, 70. So it's relatively low. The complete lockdown was finished last Sunday night. We have now the schools are officially open, but since the school year is almost over, then the teachers are now concentrating to those students who were not doing very well during this distant learning. So those kids who did very well, they don't go to school because the teachers are focusing to someone else. The healthcare is open, the shops are open. There are currently plans to open cinemas since 1st of June, but of course, if something happens within this week, then that's not going to happen. Our restaurants are open, our shopping centers are open, our public transport is more frequent than it used to be. We have a connection. We established or re-established our connection with Finland. So we had many people working in both sides of the Baltic Sea. So several Finns were working in Estonia and many Estonians in Finland. So those people can now go and work there and come back to their families, in whichever country they are. We have this sort of Baltic bubble with Latvia and Lithuania, where the borders are open and there is no border control and people can freely move. We still have we do a lot of testing. We are very conscious that people who come to aerosol generating procedures to hospital need the surgery. They will be tested before this surgery will be done. We do a lot of testing. So we are conscious but trying to move on with our lives. So that's the current situation. But we are monitoring and we have always said to government that we need to prepare. We need to be ready to close something if this becomes necessary.
Okay. Honorable Professor, thank you so much for the interesting interview and your valuable opinion. Stay healthy and safe. Thank you.
The same you, and stay healthy, and thank you very much for organizing this type of educational work. Thank you very much.
Thank you.
Bye.
Professor, I have just one more question.